Hi guys, this is Dr. Ed. You're coming from the office today. I want to introduce you to Dr. Molly and an amazing, cool story. Dr. Molly is the naturopathic doctor in my office 3 days a week, and she does women's care in her office 2 days a week, where she detoxes women who want to get pregnant and integrates care for women, with all sorts of different medical issues. So we want choices, and Dr. Molly, we're so privileged to have her here. She gives a lot of choices, but she had a really great story a few months ago. She saw a baby and she saw something in physical exam, so I want to introduce her to you and have her tell you a story. This is about vitamin K, and bleeding. And even though, as a little disclosure, this is not all encompassing, and this is just informative for all our families. So ready? This is Dr. Molly. So Dr. Molly,
Hi.
what happened recently?
So I was doing a routine exam on a 2-week-old baby and checking out the belly, and pushed on the belly button, and it filled with bright red blood, which is unusual at that age, especially because the umbilical stump had fallen off a week before. So that kind of tipped me off that something might be up with blood clotting. And we ran some tests, and sure enough, the baby had what's called vitamin K deficiency bleeding of the newborn. Luckily, a mild version, and we were able to get the baby the vitamin K injection, and the baby's doing great.
Wow, that's not something, in 15 years that I've been practicing, I haven't really seen that.
No, it's not very common. We don't have great numbers on how often it happens, but every baby is offered vitamin K, an injection here in the United States at birth to try to prevent that, because sometimes it's mild like that, where it's just the belly button bleeding or a little blood in the stool, but worst case scenario, it can be bleeding in the brain.
Yeah, that's not good. Brain, gut, these kind of things we don't want. So what are some options? So what do they do in the United States in general, and what do you do that's different? That allows some people to know something that they don't know.
So I used to be a midwife, a licensed midwife, and attend births and at home. And so part of that was offering the same things that babies are offered in the hospital, which the vitamin K injection is one of them. So that's the standard in the United States. Other countries do an oral option, but here in the US, there's 2 injectable versions. And in doing my research, because most of the families I worked with as a midwife, and certainly a lot of our families here, really want to know what they're injecting into their babies, if they're going to do that. So the vial here, this one has a little bit of a preservative in it, and it also has a tiny bit of aluminum. So when we compare it to the amount of aluminum in a vaccine, like the hepatitis B vaccine that's offered at birth, which has 250 micrograms of aluminum, this has 0.05 micrograms of aluminum, so it's much smaller. But this one doesn't have any aluminum, and it doesn't have any preservatives. So for a lot of my families, it may, if they were able to get this one that doesn't have preservatives or aluminum, might make the difference for them to choose to do the injection versus not. So this is the one I carried in my practice. It's a little more expensive than this vial. Certainly a lot of hospitals carry this one, and most midwives will carry one or both of these.
So great. So there's different choices, and most people don't know they can decrease some of the toxic load in them. And you said a lot of hospitals carry it, so you must ask, if you want to know what exactly you're giving. There was something about oral vitamin K. So what is that about? What?
Yes, so the countries that use an oral vitamin K option use a pharmaceutical version. We can't get that here in the United States, so the one that we can get is more of a vitamin over-the-counter oral liquid. And unfortunately, that's not as tightly regulated as the medications are in this country. So, but for some families who are just completely against doing the injection, the oral is an option to do, better than nothing.
Great. So one thing I do mention for our families, that if they're going to do the circumcision, if that's part of what you're going to do the actual injection, because it works much faster. So you do have a choice now that Dr. Molly showed you, to use an injection that doesn't have vitamin K, and it doesn't have aluminum. But that's the biggest thing. Bleeding is one of those big things.
Circumcision, my big things that I would always recommend, if there was any obvious bruising at birth, if we had needed a vacuum to help get the baby out, then big bruise on the head, I always recommended the vitamin K, certainly for planning circumcision, which is a little surgery. We want the blood to be able to clot. And even if mom needed antibiotics or the baby needed antibiotics, because that sets back the gut flora development, and that's ultimately where the baby will start making more of their own vitamin K.
How did this baby do?
Baby did great.
Okay.
He's doing great.
That's great. So the goal is to make sure that you know you have choices and ask the questions. These are your kids. We want you to be empowered. That our goal here is to really, really make sure that you can have informed decision. We're very grateful to have Dr. Molly. We love her. And we want to wish you guys a wonderful long weekend here. Love you guys. Off Dr. Molly and Dr. Ed. Bye.